Hi, my name is Dylan.
And I'm Taniel.
Today we're going to be doing a presentation to caregivers on managing mental health in older adults. So what are we going to learn today? So we're going to understand why mental health is important to older adults. We're going to identify risk factors that contribute to poor mental health. We're going to recognize some signs and symptoms of depression and anxiety. We're going to learn how to address mental health concerns. We're going to learn ways to care for yourself while being a caregiver. And we're going to learn some local resources to improve mental health. At the end of the presentation, we're going to have a bit of a knowledge test, and you'll be provided with the information that you learned in this presentation on a pamphlet. So why does mental health matter in older adults? So mental health impacts your overall health, and what it includes is emotional, psychological, and social well-being, which affects how we think, feel, and act in our daily lives. Older adults, they face different challenges that affect mental health compared to younger people. Often, sadness, detachment, and worry is considered a part of aging, and this is not normal. Mental health disorders are common in older adults, yet they go undiagnosed and untreated oftenly. And although supports are available, older adults are reluctant to seek them. And poor mental health can decrease the quality of life of older adults, limiting physical health, affecting social interaction, and leads to a higher rate of death among the older adult population. So we're going to talk about some facts about mental health. 14% of older adults experience depression. 1.1 million Canadians over the age of 65 will experience loneliness. In Canada, men over 80 are most likely to die from suicide. 1 in 6 deaths by suicide is among an older adults that are 7 years or older. 50 to 70% of older adults who need mental health support do not seek it. And 40% of older adults with depression also experience moderate to severe pain. So what are some risk factors for poor mental health in the older adults? Well, we have our physical changes. They're often unavoidable. It affects our appearance and our self-esteem. We have hormonal changes. We have reduced strength and balance that affect our physical activity. Then we have changes in hearing and vision that impact our ability to communicate. For chronic illness, we have pain and fatigue, medication side effects from treating chronic illnesses, fear and helplessness feelings, and worsening of our chronic illnesses. It's determined that 1 in 3 Canadian citizens have 2 or more chronic diseases currently. And for financial stress, yep, older adults often have a fixed income on their pensions. There's medical costs associated with chronic illness and older age. We have fear about outliving savings, and often older adults can be financially dependent on their family. And we have loss of loved ones. So older adults are more likely to experience loss of loved ones, which contributes to feelings of grief, bereavement, loss of support networks, role changes in their lives. And more than 2 in 3 older adults have experienced at least one experience of bereavement in the past 2.5 years. And so loss of independence. So there can be threats to identity, loss of control over their lives, transitioning into long-term care homes, for example, loss of purpose in life, and fear of burdening others. And then we have isolation, lack of access to transport, impaired mobility, loss of friends, and communication impairments. And approximately 1 in 4 older adults are affected by isolation. Now we're going to talk about depression in older adults. So depression is a disorder that changes the way you act, think, and feel, and it usually causes long-term sadness, and it will negatively impact your daily living activities. And so there's a variety of symptoms associated with older adult depression. And so we keep it simple with the mnemonic siege caps. So we're looking for changes in sleep, interest, guilt, energy, concentration, appetite, movement, psychological, and suicidal thoughts and behaviors. The main challenge with older adults is they're often reluctant to speak about depression due to large amounts of judgment in the past. Key behavioral warning signs for caregivers are changes in energy, sleep, or appetite, changes of use in alcohol or other substances, avoidance and isolation, and withdrawal or decreased enjoyment from normally fun activities. And the reason why we look out for key behavioral warning signs is often older adults are reluctant to report the emotional and cognitive signs of depression. And what are some potential outcomes of depression? Well, there's malnutrition, insomnia, confusion, which can lead to falls. It can speed up the progression of chronic illnesses, and in severe cases, suicide. Now, suicide is quite common among older adults compared to different age groups. And so understanding how to perform a suicide assessment can help us identify suicidal ideations and prevent it from occurring. And so assessment includes the ideation of suicide, changes in substance use, purposelessness, so feelings of having no purpose in life, onset anxiety and agitation, feeling trapped, hopeless and helpless, withdrawal from daily life activities, anger, recklessness, and mood changes. Now let's talk about anxiety in older adults. So anxiety is an unpleasant feeling of nervousness or fear accompanied with physical changes in the body. Normal in stressful circumstances, but however, it becomes an issue when it's long-lasting and interferes with your daily living. And so challenges with anxiety in older adults is that they're less likely to report emotional symptoms like stress, worrying, and fear. If they do report symptoms, they will often attribute them to physical health problems, and they're likely less willing to acknowledge that anxiety pertains to their situation. And so what are some key symptoms? Well, what is often reported are digestion issues, headaches, shortness of breath, and heart palpitations. And so the caregiver can look out for these. As well, the caregiver should observe for behavioral changes such as restlessness, tremors, and avoiding activities such as doctor's appointments, physical activity, and socializing. And the reason why is there's an underlying fear, which can lead to anxiety in these situations. And what are some potential outcomes of anxiety in older adults? Well, there's increased doctor visits, decreased physical activity, difficulty sleeping. So it'll essentially interfere with your activities of daily living, and it overall leads to a negative it decreases your quality of life and your overall well-being.
So, what can be done about mental health? Well, there is no simple solution. It can be addressed in a variety of ways. As a caregiver, you should know the warning signs of mental health concerns, create a safe space, start those difficult conversations, support open communication, validate and reassure the person you're caring for, support active participation in planning of their own health, understand your own limits, and identify and use resources. There's also medical ways to deal with mental health, including using mental health professionals that can be consulted for assessment, treatment, safety plans, support, community health workers, which can help with monitoring symptoms, maintaining daily living skills, and social support, as well as hosting group meetings. There are other forms of professional treatment for anxiety and depression, including therapy, counseling, medications. In terms of non-medical interventions, social activities 2 to 3 days a week have shown a decrease in depressive symptoms. Maintenance and promotion of this is key. So encourage healthy coping behaviors, involvement in enjoyed activities, talking to someone that they trust, spend time outside, exercise, increase social interaction, encourage them to do some volunteer work, community activities, maintain connections with family and friends, and use those community programs. So, self-care for the caregivers. It's important for you, the caregiver, to be able to refresh yourself. Without this, it'll lead to your own worsening mental health and stress. So, a lot of caregivers report feeling overwhelmed, anxious, tired, and having poor mental health. So, we need to talk about some positive coping mechanisms. So, take time to meet your own needs, eat, have water, shower, find balance between caregiving and personal life, join a support group, ask for help from family or friends, exercise, use respite and community resources. So respite are programs that allow you as a caregiver to take a break without worrying, as trained professionals will temporarily take over care. This can be done through the community, or if you have home care, you can talk to your case coordinator, and all of that will be in the pamphlet at the end. So resources to help maintain good mental health. We have Out for Lunch, which is a program for 55 plus, to meet with others the same age and enjoy a meal. There are Senior for Seniors scheduled activities. So there's a whole bunch of different activities hosted throughout the month, and there is a schedule if you contact them. There is the age-friendly Brandon telephone information line. So essentially you give them a call and they'll update you on all the programs and different services available. Connect is a program over the phone where you have conversations with volunteers. And Seniors Without Walls is a group for activities over the phone. There is also professional help. So in case of course, any emergency, call 911. There is also the mobile crisis unit, so that can assist with providing resources, coping ideas, support, or crisis intervention and follow-up. If you receive home care, you can talk to your case coordinator about the adult day program, essentially another form of respite. There's also the seniors mental health program, which helps connect them with a healthcare provider for assessment, treatment, and to discuss any concerns. There are many different healthcare workers involved in this assessment, and they follow up in the community. So the key takeaways: understand importance that depression and anxiety are not a normal part of aging. Mental health disorders often go undiagnosed in older adults, and poor mental health affects overall health. Recognize the signs, the changes in mood, loss of interest in normally enjoyed activities, changes in sleep and eating changes. Know the risk factors of social isolation, chronic illness, loss of loved ones, loss of independence, and physical changes, as well as isolation. Respond. Identify the concern, communicate respectfully, validate feelings, discuss and seek professional help, promote participation, encourage activities, maintenance, and follow-up. Self-care, know your own limits, find a balance, meet your own needs, reach out to others, use community resources, and participate in stress relief activities. So the resources that we just touched on: Out for Lunch, Seniors for Seniors, Age-Friendly Brandon, Connect, Seniors Without Walls, and the Mobile Crisis Unit, as well as the Seniors Mental Health Program. So here's a knowledge check scenario. So Mr. Smith is an 81-year-old widower living in Brandon, Manitoba. Recently, Mr. Smith's companion dog died from old age. Shortly after this loss, he stopped attending his weekly chess club and no longer leaves his house to go for walks. His friend and caregiver, Alexa, stops by his house daily to help him with cooking and cleaning. Recently, she noticed that Mr. Smith has eaten very little, is less talkative, and seems more irritable than usual. Additionally, she has noticed that Mr. Smith has bills cluttered on his dinner table, and he forgot to take his medications a few times this week, which rarely ever happens. Alexa asks him how he's feeling. Mr. Smith sighs and says, "I'm okay. I've been working on a plan to meet my wife again soon." So there's just some questions on the other side. We will let you work on them. If there are any questions that pop up, you are more than welcome to come reach out to us. And this should just help you feel a little bit more comfortable with the information that we've provided you today. And we will be giving you the pamphlet, which can help you answer these questions as well.